Hey there, this is Dr. Ankur Prakash, and we've got Dr. David Lekovich here. This is our first and of many podcasts that we're going to be doing here. We're going to call it the Balanced Podcast. So there's a lot of background noise. Is that you guys hitting that? Is that you hitting stuff or?
That's David.
Okay.
Oh, shoot.
To the Balanced Podcast here, hosted at Living Well Balanced in New York, New York. I'm Dr. Ankur Prakash, and with me is
Dr. David.
Awesome, man. This is Dr. David Lefkowitz. This is my boy, my partner. We are the owners of the Living Well Balanced. We've got a great physical therapy, occupational therapy, chiropractic office here in New York, New York. Our vision about this podcast is to really, we one of our biggest shared values is teamwork and collaboration, and the big thing with collaborative healthcare in this current environment is that, hey, we've got a lot of people getting sicker, more stressed out. I'm gonna time that just because we got printers coming. Hold on. Sorry. Our vision about this podcast, and Dr. Dave, you let me know if I'm missing anything, but we've got a lot of different services all under one roof, and we're not just multidisciplinary. We're actually more than that. We're all about collaborating and integrating our own services with each other, and then also with other therapists in our practice. And that's a skill set, that's a culture fit that is definitely above the normal standards for healthcare. So our vision behind this podcast is to share stories on how we put our heads and our experiences, our backgrounds, our degrees together, and how we really get people healing better from the inside out naturally. Did I miss anything?
Yeah, I mean, I think today in healthcare, especially in America, United States of America, or North America in general, so much of healthcare is so kind of looking through a very narrow tunnel, right? And we're trying to really expand that tunnel. So I think part of that podcast is showing how we do it.
Yep. Yeah. I think our country's healthcare. We're ranked 37th or 42nd, depending on what you read, in terms of all the industrialized countries and nations in the world. And we spend the most on healthcare. I remember when we opened up the business in 2004, the average was $4,200 per year spent on sickness care per man, woman, and child. And that number has gone up to just shy of 12,000. Right. And so, and we'll make sure to put any references and links to all these stats that we throw out. But the big thing is that, hey, we got to stop looking at parts, and we got to start looking at the whole. And we got to start looking at not just holistic with an H, but whole with a W, because healthcare it's getting trickier and trickier, as Dr. David and I are going to share on this podcast. There's we've got stories that we've heard about people not having great experiences with physical therapists or with chiropractors. And I think that's going to be one of the big focuses on today's podcast, and how we balance that out. But we want to make these podcasts educational, but more about also entertaining, a little bit of fun. What else? What else, Dr.
I
Dave?
mean, there's nothing more entertaining than a physical therapist and chiropractor doing a podcast together, right? So I think that's a great way to begin, right?
Yeah, dude, it's so true. And so, hey, why don't you talk a little bit about your role at Living Well Balanced, and talk a little bit about yourself?
Yeah, absolutely. So I joined Living Well Balanced because of that exact reason. There's so much going on right now with physical therapy, and with the decreased reimbursement costs, it's so hard to run a physical therapy operation. And I've been doing that for the better part of a decade now. And I was looking for something else, something collaborative, integrative. Physical therapists are very, we have big egos as a profession. And because of that, we really pigeon ourselves into our own little bubble. And I think it's a big problem. And that's really one of the reasons I'm excited about this podcast. And I was really excited to join Living Well Balanced. And so that was kind of what led me here and brought me here. And super excited to be running the company at this point in New York with you, of course. And very excited about the podcast to see what happens.
Yep.
Should be good.
Yeah, and I think, the great thing about the listeners of it, they could come from an entrepreneurial background. They can be coming from the healthcare background. And I think per our marketing director who's staying quiet during these podcasts, Isabella wanted to also make it even from a consumer background, like a healthcare consumer, people who are interested in just our approach to certain healthcare conditions and how it's outside of the box. So that's kind of been like our vision behind Living Well Balanced. As you guys listened to Dr. David said that he joined the company in 2019. He didn't just join the company, he advanced it. He took it up a level and added both physical therapy and occupational therapy. And we've got a bunch of other new services that we've added. I started the company here in the Upper West Side of New York, New York. For those of you not familiar with the anatomy, that is right to the left of Central Park. So we're looking at the west side of Central Park, close to the Museum of National History. First day of practice was what, September 4th, 2004. So we've been in the business and the service of helping people heal themselves in just shy of 20 years, and looking forward to the next 10, 15, 20 years as well. So Dr. David is running the practice here in New York. I live in Raleigh, North Carolina. I've been there for just shy of 9 years. And I run the Raleigh, North Carolina office, and I come up here 1 to 2 times a month and help facilitate growth in the chiropractic department and just help with any type of marketing events and team development. So here we are. So let's begin. What I think the theme that our marketing master told us to talk about today is just horror stories, right? There's some like fun, really cool, exciting testimonials and success stories, but there's an equal amount of opposite ones, sadly. And then, we're using a forum right now called Reddit, for those of you that are below the age of 20, unlike me. This is a big forum where people can kind of post and comment and question different stories in different types of fields, not just healthcare. But one of the ones that was forwarded to me was a story that was on Reddit, and I've got it in front of me. I'll kind of read a little bit of it. I've been to a chiropractor once. I have a physical condition. It causes pain and stiffness in my spine and joints. This person had a shoulder injury, and so she was recommended to this amazing, unbelievably fantastic chiropractor. And she tells the chiropractors about all her issues, and it's like, all right, it's all good. Let's start off a little bit easy. And sadly, she had what a lot of people, thank God, not everyone, but a lot of people have had, that that her joints were hurting a lot more. There was a lot of sounds that created what she referred to as a fire at a popcorn factory. It was her first time getting her neck adjusted, so the twisting, the pulling, the cracking, she's never had that done before. Towards the end of it, she writes that this was, a torture session. She could hardly walk the next day. She had the worst migraine. Her shoulder was hurting. Anyway, she just didn't have a great experience. And the last part she put, which really, really I wanted to address as well, is I'll never go to a chiropractor again, no matter how good they're supposed to be. So before, yeah, go ahead, get it out of your system, physical therapist. What do you got to say about that?
Oh boy, that's really how physical therapists think of chiros.
Yep.
We're taught in school.
Yep.
This is what chiros are all about. So I'm excited to hear. I mean, I want to hear about your perspective on it. I want to share my perspective after being here for a few years.
And let me share my response just from the lens that I view this, because I've been in this business, or in this industry, since the mid 1990s, when I got introduced to chiropractic. And when I opened up my practice, I wanted to network with as many health providers as possible, whether it was local MDs, local physical therapist office, trainers, massage therapists. And I got to tell you, you know how many of them just had wanted nothing to do with me because they were just anti-chiropractic, or they had heard of a lot of horror stories, whether they had their own patients, own clients. Dude, I'm telling you, physical therapists, I could not attract a relationship with any physical therapist, maybe one or two, less than a handful in my first 10, 15 years in practice, because they just had horror stories. They just didn't really know much about chiropractic. And I know when Dr. David and I met in 2018, 2019, you definitely did not have that perspective, or if you did, you saw behind that. You saw you read between the lines, correct?
Yeah, I mean, I had treated a lot of chiropractors, and I think that's what kind of, I mean, because how it works with physical therapists is we're so brainwashed in school that when we come out of school, especially if you hadn't grown up seeing a chiropractor and that's your first experience with it, when you come out of school, you're just the blinders are on.
Yep.
But then when I started to treat a bunch of them, I was like, wait a second,
Yeah.
maybe these really were blinders.
Yeah.
And that's kind of where it started, and then obviously accelerated once I joined Living Well Balanced and met you. But I'm curious to hear about your perspective on this before I weigh in.
Yeah. Yeah. So here's the first thing that I thought of when I first read her story, because this isn't the first time I've heard this, read this, seen this. But look, if you look at any service-oriented industry, right? Anything. It doesn't have to be healthcare. It could be movies. It could be going to dinner at a restaurant. It could be getting haircuts, freaking even getting car washes, or even going to a dentist. When you have a bad experience at a dentist, is that it? Are you ever going to get your teeth cleaned and your gums checked for the rest of your life? You had a bad experience at one sushi restaurant. Is that it? Is sushi done, or is Japanese food done, or whatever it is? Even haircuts. Like, I've had plenty of bad haircuts growing up. Trust me, my parents can show you pictures on their wall still. But I give barbers a second chance. I give dentists a second chance. I give, and I may not give them particularly a second chance, but I give their profession a second chance. I mean, do we really stop getting a haircut after we have a bad experience at one salon? I mean, that's the first thing. So obviously, this woman or man, whoever it was, had a really not such a good experience. But look, that was one experience at a chiropractor's office. Maybe it's time to look at another office. All right, so that's the first thing I look at. The second thing I look at is when it comes to, like, we're in an information overload world, right? We've been that way for a long time, but it's getting worse and worse and worse. And now people really have to build rapport and have a higher level sense of communication and trust with their providers. And so one of the things I thought about is just that, what were the expectations between her experience or his experience with that chiropractor? Right? Are we looking at her shoulder, which seems to be a chronic issue, or her neck and back, a degenerative issue? Was that supposed to be fixed in one visit? Was it supposed to be 100% relief after one visit? Some of the other stories that followed that story on Reddit talked about, like, hey, you know, they didn't give me relief after one or two sessions. Well, was that addressed with the chiropractor, right? Because there's a big difference when you're giving, your care for just symptom relief, or were you giving a care like how we do in our office in New York and even in North Carolina? We're all about fixing the underlying cause of the problem, right? We call that corrective care, or care that's involved in functioning better, right? So that's one thing that, was that addressed. And also when it comes to adjustments, and I saw that in later posts on Reddit, there's a lot of commentary on the videos, right? So people on Instagram or on TikTok, and they were getting scared watching all of these videos of chiropractors pulling, using contraptions to adjust people's necks, or lifting people up above their shoulders, and cracking their thoracic spine. I mean, there was a lot of experiences that this woman referred to with these videos that also can instill a lot of fear in people. So it to me, it just comes down to, like, the education and the connection that she or he may not have had with that chiropractor. And to me, that, in today's world, especially in a post-pandemic world, you really got to give off trust, and not just certainty, and confidence, but really give off that feeling of safety and being secure with your patients nowadays. Anything else? I mean, that's pretty much the top three things, Doc, that I think of.
Yeah, I mean, I couldn't agree more with all of those things. So much about today's society is about communication, right? And what is the communication like in this conversation, right? We're only hearing, of course, one perspective, but really communicate. I mean, if I'm a physical therapist or a massage therapist, right, and I'm going and doing a really aggressive hands-on technique, and I'm not educating first about, well, what's the result of this? What's the purpose of it? Um, I'm not sure that the person who's receiving it is going to feel like that.
Mm-hmm.
And it's really hard to know what the communication was like. What I do know is that from all the chiropractors I've seen in our offices, the ones that spend the most time and communicate and educate and build that trust, like you were talking about, are the ones that have extremely few complaints, extremely few bad experiences. Because at the end of the day, like you were saying, with any profession, or any service, really, it's all about communication. It's all about communication, building that trust. It really is.
And I think one of the things about just our office is that if you look at all the providers that we have, whether the OTs, PTs, DCs, we have a lot of tools in our tool belt, right? And one of our big philosophies is that it's not a one size fits all. We don't put everyone in the same exact treatment plan. We don't use the same exact methods and techniques on every single patient. It's
Well,
different,
yeah. I mean, if I'm doing an
right?
evaluation, right, and someone comes in, they're like, "I hate being touched." Is my
Right.
first is my first go-to going to be, let's give this person the most aggressive trigger point release I could find, right?
Yep,
No, of course not.
exactly.
Right?
Yeah.
So that's a lot about that communication. Also listening. You've really got to listen to people today. Not that you didn't have to listen to people before, but it's just so important, especially like you were talking about the information overload. It Trying to get a sense of what someone is looking for, and what their history has been with this profession or this technique, it makes a huge difference.
Yeah. Yeah, and this person seems to be like, she was also recommended to this, what she referred to as an unbelievably fantastic chiropractor. And, a lot of times we get a lot of people from Google, right? Or Yelp, or, any places where they trust reviews. And I get it. Online reviews are now worth more to a small business than an actual referral to our office. But for me, I still trust referrals over online reviews any day, right? So, and that comes to, when the person found this chiropractor, hopefully she was recommended to them because that person had a great experience and she didn't just read about them online, or she just saw a bunch of videos that made them look good. That's another thing that who knows what her experience was like on how she found him.
Yeah, that's hard to know based on the
Yeah,
story.
it is.
Sure.
It is really hard to know. So yeah, so that was the story that I read on Reddit. So Dr. David, what'd you say, man?
Yes.
There's got to be people that hate physical therapists.
Yeah, well, this is an interesting story. It's actually not a physical therapist horror story. It's more of a comical story that I found on Reddit that Isabella produced. By the way, I had never even heard of Reddit before this, so interesting to know all all these articles on this forum.
You're old.
Yeah, seriously. Interesting, but yeah, it is an interesting story, and it requires a little bit of background on a total knee replacement. A lot of times people come in after undergoing a total knee replacement, and part of the rehab process is to improve mobility and strength, right? But one of the main things that happens after a total knee replacement is the bending motion of the knee is usually really restricted, and we work really hard early on to not have the scar tissue build up and really just try to get that full range of motion going. So this is a story about a first-year physical therapist who had a total knee replacement patient. He was a Mennonite dairy farmer. I don't know what Mennonite is. Not sure if you do, Encore.
Mennonite, I think it's
Mennonite.
Yeah, Mennonite.
Oh boy, that's really bad. Okay, what does that mean?
Don't know.
Okay, how do you know it was Mennonite?
Actually, don't know.
All right, and he's also 6'3" and all muscle. I cannot emphasize enough how solid this guy was. A total man in capitals. So there you go. And what happened is he was struggling to really bend the knee. And typically what they'll do, and he mentions this in the story, is they'll go under anesthesia. The surgeons will put them back under anesthesia and then just crank that knee and just break through all the scar tissue. But he didn't want to do it because he didn't want to pay for the anesthesia. So he asked the physical therapist if the physical therapist could do it. And the physical therapist says, sure, but there's a reason they put you under anesthesia, because it's pretty much torture. But he continued to demand it. And so they went to town next session. He came in, his leather brown Chuck Taylors and cowboy hat, ready to get down to business. And they went into a private room. He pulled his leather belt from his jeans and put it in his mouth and bites down and grunts, do the damn thing. So then they ended up pushing the knee as far as they could. And then the knee sounded like a shotgun went off. And the patient started screaming. But they were able to proceed and push through and obtain full range of motion in the knee. And everyone was high-fiving. And it was a big party. And then when the patient left the clinic, it was silent because people thought that he was shot and died. So he came in 1 week later, smiled, and brought in a gallon of the best cheese curds they have ever had. And he is still doing great. End of story. So that's
That's your horror story?
this is what I was given. I don't think this is a horror story.
Yeah.
It sounds like a success story, possibly.
Yeah, exactly.
Or a comedic success story. But yeah, so I'm not quite sure what to say. I mean, it's certainly not a horror story. I have not seen this before. This is certainly something that's typically done under anesthesia. But and part of the reason they do that is because it relaxes a lot of the soft tissue, a lot of those painful response areas. So people typically can't physically do this, but I guess those dairy farmers are pretty tough, and they were able to do that. But yeah, I mean, what's your thoughts on this as
I don't know.
chiropractor?
Yeah, I mean, it's funny how they said like it sounded like someone shot a bear. Like, yeah, I mean, I guess when you have that joint makes that much of a noise, I sometimes it pops and makes a loud noise, sometimes it doesn't. It's so funny. My initial response when I was first read this was like in chiropractic school, a lot of my comrades always never called you guys physical therapists. They always called you physical terrorist, and I guess that's why you got these shotgun noises coming out of your
Yeah.
No, I think that's awesome, man. I mean, I look at this as a success story.
Absolutely.
Yeah.
I mean, to avoid anesthesia, just first and foremost is I mean, obviously the reason was because he didn't want to pay for it, but to avoid going underneath and then ending up with the same result is really cool.
Right. And we've got a profession that's been growing now in the last 15 years for manipulation under anesthesia.
Oh, it's huge.
Right. It's a huge thing. And obviously that's the one extreme when you're doing, whether it's gross or specific joint manipulation where you do need to be put under to get that done. But no, I mean, I look at this type of story kind of similar to the stories that we've seen in our office, man. We do what it takes.
Yeah,
right? We do
absolutely. Absolutely. And, obviously the goal is to avoid those situations. The MUA, it's called manipulation under anesthesia, and providing a lot of that soft tissue, that education early on, really does help to avoid these situations a lot of time.
Have you had to doc? You how long have you been in practice now? Because you before
coming up on a decade.
A decade, right? So
I'm dating myself further now.
any have you had one or two like really crazy physical therapy stories?
Yeah, I certainly have. I certainly have. We've had wow. There's a lot. There was one time where someone came in from a quad tendon rupture, and he had surgery. For those who don't know, a quad tendon is the tendon that connects the thigh muscle to the knee, basically. And a lot of times when people are skiing and they fall, it ruptures and needs to be surgically replaced. So, and that was the case with this guy's big skier. He was actually, I think, 80 years old. He was fairly elderly, but was still skiing pretty competitively. Great shape. And he came in, and the second week he was in, I was treating him, typical physical therapy session, and everything was going great. And, I just noticed he was coughing a little bit. Obviously, this, by the way, before the pandemic, so there was no COVID in existence. But, just coughing. And, I said, "Oh, you okay?" He's like, "Yeah, just come down with something." I said, "Okay," And it didn't make much of it. 3-4 days later, he canceled his appointment. And, the receptionist said that he was in the hospital. And I said, "Oh, like, what happened? Is he okay?" And she said, "Yeah, I don't know. He was apparently in very serious condition." So I ended up giving him a call, and he had what's called a pulmonary embolus.
Mm.
Again, for those who don't know, after surgery, people are a little bit more predisposed to what's called a DVT, or a deep vein thrombosis, because they're a little bit less mobile, and that area can clot. And then sometimes that clot breaks off and goes to the lungs, which could be a severe life-threatening issue. And so that was quite the horror story. And so really, when he was coughing in the office the other day, that was because that pulmonary that blood clot had already broken off and was in his lungs. So it was a scary story, and definitely will never forget it. I mean, thank God he was fine, and he was back a few days later, actually. But it was scary. It was really scary, especially as a physical therapist. So that's not a good story. That's a horror story right there.
Well, yeah, I mean, I think I think our marketing person wanted us to talk about crazy stories.
Oh, was that too horror?
I don't know. I guess. I mean, I've got, I think for us, like, even if you like, for the chiropractic industry, if you Google what are the contraindications to chiropractic, like, of course, Mayo Clinic comes up first, and they talk about it, whether you've got someone who's got a history of stroke, or you've got osteoporosis, osteopenia. I think in my experience, so now I'm coming up to 18 years in my practice and clinical practice, and I would say probably the only things that really stand out for me is ribs. And I don't think I've ever fractured any ribs, because I've always done x-rays on people where I thought that I may have dislocated, but it was literally just a minor dislocation of a rib head. I don't think I've ever fractured anyone, even people who've had osteoporosis or osteopenia. I've definitely had my fair share. I mean, you know how our office is. We have an open adjusting room, and we like it that way, because we know any conversations, especially for new patients, we have in a private office. But in terms of treatment, we like it to be in the open, because it creates a community feel to it. It becomes the patient education can become cross-contaminated, meaning that if you're educating someone on the benefits of massage therapy on this area, or stretching, or omega-3s and supplementation, it's nice to have the rest of the people in the room hear that. But the downside is that when you do get that rare experience, when you're like, "Oh my God, this patient just yelled and screamed during their adjustment," or complained about this, and we've had a few of those over the years, but I can't really think of any horror story. I know in my other practice, we just had an older practice member of ours, so we call them practice members, not necessarily patients, but he's in his early 80s. He fell down his stairs, and the first thing he wanted to do, because he was already a regular practice member of ours, he wanted to come and have me check him out. So this is on a Saturday. He fell Saturday morning. His wife calls the office, tells hey, he wants to bring him in. And you could just tell by looking at him, he dislocated something, he fractured something. I have no idea. All I know is that I sent him for x-rays immediately right down the street where we are. He got x-rays, and of course he had displaced 4 or 5 ribs. He had not an AC separation, but it definitely was superior and kind of dislodged. And here's the crazy story. I saw the images immediately, and I told him and his wife, bring him back. And he comes back, and of course the office hours are now closed, because what I wanted to do is I lay him on the table and I set his AC joint, his sternoclavicular joint back in. I adjusted his ribs. He screamed. I probably shit my pants, if we're allowed to say this, but it was very scary. But I felt really confident that I could help him, and he felt the trust and the safety in my hands, and that was probably one of the most recent crazy story that I've experienced, and that was maybe 2 months ago. So yeah, man. I mean, like, he's, fast forward, he still comes into our office once a week, sometimes twice a month. He's moving his shoulders up and down. His posture is way better. And being an 82-year-old man, he's moving around still really well. And, I can't imagine what his life would have been like if I didn't set those bones into proper place, if I didn't give him that amazing life-changing adjustment where he'd be suffering for months and months and months. The typical, I don't know what, when Doc, this, when someone fractures their ribs or dislocates them, how long does it typically take? The older you are?
Yeah, I mean that's an incredible story. I mean, I think
Dude,
it's
it's
what
like
8 to 12 weeks or something like
at
that. But
least, at least.
and by then every single muscle in their body has atrophied, right?
Yeah, yeah,
And it's really like a slow decline.
yeah,
And we have someone currently in our office
yeah.
who I'm not sure if I'm allowed to say this. I don't know. Okay, yeah, 'cause this is a really good story. Positive story. Someone who has been a practice member of ours in New York for a long time, who recently had a fall and fractured his shoulder and recently underwent shoulder surgery. And I've been speaking with them several times over the last couple of weeks, and we're hoping that we see them tomorrow, actually, because it's not even about the shoulder as much as it is about just functionality and making sure you're walking, making sure you're moving, making sure you're, and he wants to come back tomorrow. I mean, he's just he was on a great exercise routine and he was doing amazing, and he's just getting depressed being at home and dealing with this shoulder. He just wants to come back and move again. So these stories are amazing, and too much in our society today we're really about, hey, just hang out and slow down and let things heal.
Mhm.
And sometimes yeah, it's just not the right advice.
Yeah, even if you look at like one of the next things that we wanted to talk about is just mistakes that we've made. Like there was a shirt that had a quote from Nelson Mandela, and I hope I'm not butchering it, but I either, how did he talking about, like he either wins or he learns, right? Or because it's never about losing. It's never about, it's the fact that whenever he makes a mistake, he always has a lesson to be learned from it. And I'm sure between the two of us, our 30 years of being in private practice, we've had mistakes that we have made. And for me, my mistake has always been when it comes to patient care, that sometimes I press too hard, like I'm a little bit more aggressive in my touch. Yes, I adjust babies and infants, and I adjust 90-year-olds and everywhere in between, but just sometimes I may have been a little bit too heavy-handed when I adjusted someone's thoracic spine, or a little bit too much force and with velocity when it comes to adjusting someone's neck, or too much rotation in their lumbar spine. But I always feel that, hey, look, saying sorry is huge. And also just, when it comes to like like deeply caring about someone, I don't think it's the mistake in it of itself that gets doctors and therapists in trouble. I think it's not handling your mistake and
I
taking care of them that gets you in trouble.
I couldn't agree more. And we see this a lot in the physical therapy world when someone comes in post operatively. And, there's really the conservative approach to take or the more aggressive approach. And I've always been in favor of the more aggressive approach. And I'll just tell the person, and as long as you're on the same page, I'll say, look, this is the rehab protocol with this surgery. And we can either just take a more conservative approach and play a little bit safer, or we can try to really get you better and accomplish your goals and the reason why you're here.
Mhm.
We don't want to get your arm overhead to 150 degrees. We want you to be able to play baseball again.
Mhm.
Right. And so as long as that communication is crystal clear up front, I completely agree. I think it's worth taking a chance sometimes, and a calculated chance,
Mhm.
uh,
Yep.
that you can, especially with our expertise and our professionals, that because at the
Yeah.
end of the day, we're here for people who are coming in. We're not here for us or for numbers. Right.
Dude, isn't it cool though? Like when we're in our office, right? We've got however many chiropractors, we've got however many PTs, OTs, MTs, personal trainers. We have so much experience. I wonder if you've added up the amount of years that all of us have been under licensed in our respective health fields. I mean, that's the beauty about having a collaborative approach, is that if we're having a struggle with a corrective structural thing, then we can lean over to you guys, to the therapist, and you guys can help us out with the functional stuff or the soft tissue stuff. So
Absolutely. I mean, absolutely. And that's, one of the reasons that we brought in occupational therapy as our most recent profession that we brought into the office about a year ago. And one of the reasons was we had a couple of people, and because they are really experts in the hand and the wrist. And we had a couple of people that we didn't feel we were 100%. We didn't have the incredible knowledge that is required for those professions. And since we've brought that in, it's made an unbelievable difference to have them as resources.
True. I can't never ask you this. How much do you pay for malpractice for physical therapy? What's your annual malpractice premium?
It's about $400
a year. That's it.
a year. Yeah.
That's it. So I don't know, those of you who are listening, I mean, unless hopefully you know this or maybe you didn't, but the way that health or insurance companies create the premiums, the biggest reasoning behind it is the number of claims and the number of relative risks, whether it's a casual inference or an actual causation. It determines your premium. And so if you look at the malpractice premium for an OBGYN or a cardiothoracic surgeon, it's hundreds of thousands of dollars per year. If you look at chiropractic, so chiropractic could go anywhere from 1,000, 1,500 a year, all the way up to, like, I think right now my malpractice for, top shelf coverage is 3,300. That's it. Now it's not $400 a year, which kind of is crazy that your physical therapy malpractice premium. But then again, how hard is it for you guys for physical therapists to injure people?
So
right?
guess what the number one malpractice claim against physical therapists is? Did I ever tell you this?
It's got to. My guess is it employment?
No.
No. No. What is it?
It's burns from the heat packs.
No way. That's it.
Yep. Because a lot of times, and again, we're not a modality based office.
We do hands-on
people, right? But in some other offices where they just stick people on heat, and this isn't the topic of this podcast about the physical therapy structures, but they just put them on. They don't have enough towels. They forget about them. They disappear. Lo and behold, if you're somebody who doesn't have good sensation, maybe you have diabetes, whatever it is, you're left with second, third degree burns. Big deal.
Dude, you know what ours is? Chiropractic? Can you guess?
I assume it's about the adjustment.
Yeah, no. You would think it's about stroke, right? What's the number one thing that media always tears us apart for? Stroke. No. Stroke happens not even less than one case a year. It's less than one case a year. It's actually inappropriate touching. Inappropriate touching.
Oh.
That's the number one suit, is inappropriate touching. And then there's number two, I think, is a Department of Labor. And then number three would be aggressive adjustments for fractured, like ribs or things like that, for musculoskeletal stuff. But yeah. And we were just at a conference earlier in the fall, and you look at the cause of deaths in the healthcare system. Chiropractors don't even have one. It's less than one. They had to round up to make it a whole number. And if you look at Advil, ibuprofen from 2020 and 2021, it's 26,500 American deaths a year.
Yeah. How about complications from surgery?
Oh, forget it. Hundreds of thousands. Yeah. So for me, I'm not worried about the crazy stories, the one-offs, the spin-offs, whether it's in chiropractic or physical therapy. These are all stories that obviously have a lot of meaning and value to the person that it happened to, and I pay homage to that. But dude, it's very, very rare. It's very, very rare in our professions. So
yeah, I completely agree.
So I mean, I know this is our first podcast. We wanted to really kind of share and cast a vision about it. Again, we're gonna try to do these at least twice a month. We want to make it open to all different types of listeners, whether it's entrepreneurs, physical therapists, healthcare providers, or whether it's to consumers that want to learn more about different ways that we treat collaboratively and integratingly in our office. I know we talked a lot about the horror stories, both in physical therapy, which really was more of a dairy farmer story, but ours was more horror story in chiropractic. We both had our successes. We both had some failures that we've owned up to and some mistakes. I think moving forward, I think we're looking forward to doing these every 2 weeks. I'm pretty excited about this. Doc, anything else you want to add?
Yeah, no, I'm definitely excited, and I'm excited to get into a lot more of the nuances between chirophysical therapy and involve a lot of the other healthcare providers out there who,
Yeah.
especially in a multidisciplinary setting, which there's not too many of, and hopefully more will come. But I think we'll be talking a lot about that as well.
Yeah, yeah, and just to like end it, when they talk about, when I was looking at the contraindications of chiropractic, or what are like the top three, scary stories that people have, this is all Mayo Clinic. They all say, hey, chiropractic is great for neck pain, back pain, headaches. Physical therapy is great for this, post-surgical rehab. But if we really want to step back and kind of look at the healthcare system in a post-pandemic world, we are living really in the worst epidemic in human history. And I've just got a couple of stats that I'm probably going to share with our listeners. But 1/3 of US adults now suffer from anxiety or depression. That's according to the CDC. We've got 129 million additional new cases of mild depressive disorders as a result of the pandemic. Stress levels are at an all-time high. 8 out of 10 adults on this survey said the pandemic created a significant amount of stress. Substance abuse treatment for drug and alcohol addiction has gone up. Sleeping has, 67% of Americans said they're sleeping either more or way less than what they did since the pandemic. Weight changes, Doc, you and I have seen this now with, especially being in New York, how many people were in hibernation mode, and then now they're starting to trickle back into the office. The average weight gain is 29 pounds. 29 pounds, that's a freaking 2-year-old, right? Chronic fatigue, digestive issues.
My 2-year-old's like 18 pounds, but yeah.
Yeah, skin conditions, bowel issues, brain fog, mood swings, and eating. I mean, these are just a long list of stuff that
Yeah.
people are just getting more and more stressed out.
Yeah, and I mean, just anecdotally, when I first started working, the amount of time someone put on an intake form that they suffer, that are taking some medication for anxiety or depression, is 10 years ago. It's not that long ago. Maybe it was like 1 out of 10, 1 out of 12. Now, I mean, 1 out of 2. I mean, I don't know how it is in North Carolina, but it's
It's high.
unbelievable. It's unbelievable.
Yeah.
So we definitely have to speak tons about that moving forward.
And if you hear or read these stats as a consumer, it's like, all right, you've got one of three choices. You can do something about it and really address the underlying cause. You can ignore it and wait for it to get completely worse, right? Which is not a good thing. Or you can mask your symptoms with medications, right? It's 1 out of 3. You got to figure it out.
Or mask your symptoms with very selective treatments that don't
Yeah.
address the underlying cause. And that could be maybe individually just chiropractic or just physical therapy or just a quick massage here and there, versus really addressing the entire issue at hand.
Yep, and I'm pretty sure we're going to do more future podcasts on that, because if you're reading or listening to that as a healthcare provider, whether you are a nutritionist or a massage therapist or a chiropractor or a primary care physician, an occupational therapist, like I get it when it almost feels like you're practicing by yourself and you're in your own silos. You even if you don't have an office like ours where we have the ability to collaborate and work side by side next to all these different types of providers, start reaching out to people, start networking with other people. Obviously we're going to have our ways, we'll share our ways of getting in contact with us, because we'd be glad to find you physical therapists in your town or chiropractors in your town that we believe are congruent in our model in helping the world deal with the increased amount of stress in a holistic, full body, vitalistic perspective, and not just reductionist into a bunch of parts. So I'm excited, man. Anything else you need to mention?
That's great. I think we have from our marketer here talking about our socials, our Instagram handles. So we are at Living Well Balanced NYC. And what's yours in North Carolina?
I think it's pretty sure it's Living Well Balanced NC.
Oh, that makes sense. And our websites, of course, wellbalancedchiropractic.com. And or livingwellbalanced.com.
Yep. Awesome. Cool. Well, I'm excited, man. Looking forward to doing this every 2 weeks.
This is great. The inaugural podcast. Very exciting.